Y'all, I recently made a video. Don't look at my hands, they're kind of ashy right now. I've been doing lashes, okay? All I've been using is hand sanitizer. But needless to say, I recently did a video on TikTok just basically giving nursing students some advice, just telling them not to get comfortable because the hospital setting can be some shit. And that video got more hit than I thought it was. The video is actually currently at, let me see, 800 likes, 6,700 views, and that is crazy. But this just goes to show that there's a lot of us in the field that share the same perspective. We just probably don't talk about it a lot because there are those people on social media that say, oh, nurses are just in it for the money. My cousin is a whole trauma doctor. She even says that at some point it's for the money. Like, you can only go through so much and not just switch your mentality and be like, yo, all right, I just need to knock this, and this out and just get out and go and run. And this is why they consistently have a shortage of nurses at the bedside, because there's always going to be some shit. Excuse my language. But that's neither here nor there. This video is going to be a message to new grad nurses. Even if you're not a new grad, you may still be in nursing school and you're thinking about like what field you want to go into. Take this video with a grain of salt, but at the end of the day, still use it as a point of consideration, because it's not going to get any easier. It's just going to keep getting more and more hectic and worse. If you're a nurse that is of minority, then it's not even, it's okay. Okay. All right. So the first thing I want to talk about is having a plan. Now, I will say that for me, coming from nursing school, I was like, okay, yeah, like I just want to be in the ICU. But of course, tell God your plans and he's gonna laugh, because me being in the ICU for 3 months and they took me out of that ICU, CV ICU at that, they took me out of the ICU and they put me in CV step down, and automatically that messed with my head, because I'm like, yo, why, like, did I do something? Da, da, da. I asked them, they told me what their transgressions were, but I later found out that this is a thing that they do to people of my ethnicity, unfortunately. So with that being said, a lot of times, let's say for us Black nurses, a lot of times they'll try to push us and tell us that, oh, you have to start on the floor first before you go into ICU. You don't necessarily have to do that. As long as the facility has a residency program, then I would say just push forth and go through that. The residency program is going to be about a year. So just buckle down, do what you got to do, focus on your courses, because you're probably going to have online modules, and then just go from there. Learn, grasp, pick up everything that they tell you, and then at the end of the day, just flip it and just work and do what works for you. Because for me, for example, I'm a tactile learner, tactile / visual. So that person can sit there and tell me what to do, but on the flip side, I'm probably not going to know how to do it unless I have someone that teaches the way that I learn, and then I'm able to like really grasp and like really pick up what they're trying to teach me. So essentially, make sure that whoever your preceptor is, if at any point you feel like there is some disconnect, switch, because at the end of the day, it's going to fall on you if at the end of the orientation period you're like, oh yeah, but I didn't learn this or da da da. Okay, these preceptors still got to go back and give feedback. So if you feel like how that person is teaching you is not in line with how you learn, then you need to speak up, and then you need to be your own advocate in that place, wherever you end up. Some places will be more favorable than others, depending on who the person is, depending on who the ethnicity is, or what the ethnicity is. But on the flip side, Black, white, I don't care. Still speak up, because you will sometimes encounter those nurses that get intimidated by you, for any reason, and it's usually a situation where it's a younger nurse, a fresh new nurse that's coming into a facility, and they see that they're young and sprung and they have all these aspirations. Meanwhile, they've been sitting there, been a nurse at the bedside for like 15 or so years or 30 years, and they're still sitting there. And you're here talking about, oh, I want to be a CRNA. Oh, that's another thing too. If you want to be a CRNA, don't say nothing. Keep your mouth shut, because that'll be another thing too that they hold against you. And especially if you're in the ICU, they're gonna be like, oh, this person is only here because they're gonna be, they're gonna go to CRNA school after a certain time. Some schools just require like a year or two. So at that point, you're only gonna be there for a year or two. And then that's going to start building bad blood. And then especially if you're you're a new grad, then that's going to give them battery to be like, okay, so we need to get this person out and send them to like a step down or something, because that's what happened to me. So keep your mouth shut. Don't say too much. You'll learn the hard way. Don't say too much. I'll have to learn the hard way. So I'm just trying to give y'all this information just to help you, because I really wish that I wish that the things that I had to learn the hard way, there was someone there to like give me like a little, hey, just in case this, or hey, just don't do, like a little tidbit here and there. So keep that in mind. The second thing I want to talk about is the fact that the portrayal of nursing on social media is not 100% accurate. Okay, don't get me wrong. Depending on what the facility is, depending on the state, you do get compensated very well. But it can also be kind of misleading, because it's like, oh, you're living this glamorous life and everything. No. You're getting paid well, don't get me wrong. But at some point, when you start to really own into your craft and you're years into it, and you're trying to like switch, you're trying to pivot to another specialty, and it's like at this point you develop certain expectations for the amount of money that you should be making, or you think that you should be making, and it's just not it, because the facility does not think that you deserve to make that amount of money. And then at that point you're like, well, I'm working so much, but I'm being compensated for so much, this much. And it's like the two of them not meshing. And I also really do think that this is why a lot of us end up going back to school, because you're at the bedside, you genuinely do give a shit about the patient, you genuinely do, but the hospital is not going to give you what you think you deserve to be paid as a bedside nurse. If you go into leadership, maybe, but then that's a whole other conversation. I'm not even going to talk about that. But needless to say, the portrayal of nursing on social media like TikTok, Instagram, is not 100% accurate. Nursing overall is what you make it. And 4 years in the game, I'm learning this. I still am learning this. Learned this back then, but every day I get a reminder that it is going to be what you make it. If you have people in your corner that have your back, that's amazing. Again, with the whole toxic nature, that can pop up too, especially again if you don't have people in your corner to like really advise you and tell you how to plan things out again in terms of like retirement or like spending or so, because you can get caught up in credit card debt real easily, because you're like, oh yeah, I'll make the money, like I could pick up a couple shifts here and there, and that's it. That gets tiring. Okay, I was on TikTok the other day and I saw this girl talking about picking up like, and she's a new grad too, I think she was like a year or a couple months in, but she's off of orientation, and this girl is out here doing, I think it was like 5-6 shifts a week. Babes, that's how you burn yourself out. And that's exactly what I did. And this is why I'm sick of this shit right now. Okay? You see a lot more, don't get me wrong. You see a lot more by picking up shifts. But on the flip side, you see a lot more. Like, it just, at some point, it just gets overstimulating. And I just feel like a lot of people don't really talk about that aspect of it, because I was 24 with gray hairs. I think when I left nursing school, finally, I was like 23, 24. I had gray hairs. There are times when my fuse is so short with my boyfriend, I really have to check myself. I'm like, yo, this is not you. Like, I'm genuinely just a patient person, but when the environment is so toxic and you're constantly in that high paced environment, it's like, yo, you're something is being taken away from you. And that's what I'm not okay with at this point. That's why lately I've been fighting so much to leave bedside. But trust me, what y'all see on social media is not it. Like, of course, HIPAA, so we still have to respect like what happens in the hospital, but on the flip side, like, whatever happens, what's really happening at the bedside is really not being talked about. Just trust me when I say that. It's not being talked about. So get in, get out. Okay. um and just to add a little bit more, when I say get in and get out, and the first point when I said have a plan, I mean to say that if you know you want to be a CRNA, again, keep your mouth shut. But if you know you want to be a CRNA, okay, go get the job in the ED, because there are some schools that take ED as critical care knowledge or critical care clinical hours for the degree. So you can do that too. So go to the ICU, go to the ED, do what you got to do, step by step by step. If they take you out of the ICU and you're like, okay, I want to go back, but I'm kind of hesitant, if they have multiple ICUs, redirect yourself and go into that one. Push come to shove, sometimes you may have to go to another facility to go into their ICU, and that is perfectly fine. Just as long as they take you, that's perfectly fine. As long as it's a teaching facility, they're willing to teach you, and you're willing to learn, then you're gonna be good. Okay. Even if you're like an ED or L&D nurse, if you're like, okay, I want to do like aesthetic nursing, and then just still do PRN, like that's the type of plans that I'm talking about. Like, know what you want to do, even if you're not even 100% sure of it, but just have something that's really pushing you. Because if you get too comfortable, that's where the problem lies. You start to develop unrealistic expectations from these facilities, and I'm saying you because I'm talking about my experience as well. I started to have unrealistic expectations from the facility, because on the flip side, I'm like, okay, I'm here, I'm working, da 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 da. But at the end of the day, if they gotta fire you, they're just gonna fire you. Like, they don't care about your well-being. So in this entire process, just be selfish. Care about the patient, don't get me wrong, care about the patient, but still be selfish. Know your plans, know what you got to do, know the boxes you got to tick to get to where you want to get, and just do that. End of story. And again, keep your mouth shut. That's that. Okay. All right. Number 3, we're going to talk about the fact that y'all should not be out here taking no sign-on bonuses. Okay. That's a trap. It is a trap. Some facilities will give you a sign-on bonus to say that, okay, you will get like $30,000 or like $10,000, but there's always going to be a time period that is linked on to that. And time period as in, they may give you like $10,000 and say, okay, now you have to stay with us for at least 2 years to get this. And then let's say at the end of the year, you're like, oh, I really don't want to be here anymore. Then you're stuck because you already have the money. And if you leave, you're going to have to give it back. So if they give you or suggest you taking a sign-on bonus, just say no. Don't do it. A lot of times they try to get a lot of experienced nurses to do it, because at this point, they're going to be doing that if they're desperate. Sorry, I was going to sneeze. But they usually offer sign-on bonuses if they're genuinely like that desperate. And it's a lot of facilities that do it, so they are that desperate. Don't do it. You're gonna bite yourself in the ass. Trust me, don't do it. I have never had a sign-on bonus. I've never gotten a sign-on bonus, but I know too many people that have gone through that entire scenario to let y'all know that it's a setup. Like, at the end of that year, they're gonna piss you off so much that you're gonna want to leave, but you know you're stuck and you're gonna be miserable that last year. Whereas if it's like a 30K sign-on bonus, baby, that's 2 years. No, that's 3 years. It's 10K per year. Okay, let's be smart now. Let's be smart. No, don't take it. Just leave it where it's at. If you really want to be funny, because I would have done this. If you really want to be funny, It should be like, you know, I really don't want a sign-on bonus, but instead I would prefer to have it split. Keep up with me now. I would prefer to have it split over a certain period of time and then have it added to my hourly. Would that be an option? And they'll probably say no, because they know what you're trying to do. You're trying to get more money out of them, period. They'll probably say no, and then they'll say, okay, well, I'm not interested in the sign-on bonus, but you know, if you want to negotiate for more money, then you can do that too. But yeah, don't do a sign-on bonus. Trust me, it's a setup. They're just trying to tie you to that facility for a long period of time, and then they're probably gonna piss you off to the point where you want to leave and you can't leave. So let's work smart, not hard. The other thing I want to talk about is whether or not travel nursing is still a good option. Now, hands down, okay? Travel nursing can be a very, very, very good option, especially if you want to leave the politics of the hospital and you just want to get some footing, get some more experience. So let's say you work at like a level 3 hospital and you want to go up to like a level 1, then that is a very good option, okay? It also will help you to expand your skills, your experiences. Let's say if you end up being or end up going back to staff nursing after some time and you end up on a committee, now you have some expertise from other facilities about something that's being talked about, or maybe like a policy that they're trying to put in place. You have expertise on that, so I will give you that very good option. Financially, let's say if you're making, let's say you're making 45, let's say you're making $45 an hour, right? So I like numbers, okay? So $45 an hour times 36 is $16.20 per week, times 52, that is $84,000 for the year. Okay, just for reference, that's $84,000 for the year. Now, if you're gonna be travel nursing, you get paid, well, now at least you get paid every week. I don't know what it was before COVID, but I get paid every week. So considering that per week it is $16.20. If you're gonna be travel nursing, then you want to make sure that whatever you're getting per week is gonna be more than this, right? When you travel nurse, the rate usually comprises of a base rate and a stipend. So the stipend usually covers your food and your boarding, which is the housing part. Some agencies do give you the option to get boarding from them, but then that means that your hourly is gonna, your travel package is gonna drop. Okay, so that's why I typically don't recommend that, because most of the time you can get something for less money, or somebody, just stay with them, period, point blank. But anyway, so 1600 per week, and this is every 2 weeks that you would get paid, so times 2, so 32.40. So what I would usually do, if I multiply that weekly pay and I don't get either more of this, I'm not doing that travel assignment, because then I'm going to be spending more than I can get. However, there are times where if you do it and it works out, it kind of makes sense, right? So with travel nursing, what they do is, again, you're making $45 an hour here, right? They will give you a lesser rate. And this is why if you're buying a house, it's not a good idea to travel nurse, because you would qualify for way less than what you can qualify for. And just in case, the stipend is not taxed. It's not supposed to be on your W-2. I think that's what it is. It's not supposed to be on there. It's only supposed to be your hourly. So they'll drop, let's say, for example, they'll give you a rate of $25, right? So 25 times 36, that's $900. $900 for the week, for 36 hours. And then let's say you see a pay package for like $2,500 for the week. So 900 minus 2,500, so that's $1,600. So the stipend would be $1,600. Just in case, the stipend, this 1,600 is not a static number. This is more so indicative of wherever you are. So the more expensive the cost of living is for the city that you choose, the more stipend you're gonna get. Okay, so all in all, that's gonna be a $2,500 per week contract. Again, you get paid weekly, so that contract would make sense. But if you're supposed to get like a contract that pays the same $25 an hour, but the stipend is like dramatically less, and you're in an expensive city, and you're gonna be doubling your cost of living because you're back home as well, like you have a place back home, then it's not gonna make sense financially. Like at that point, I would just say no, don't do it. That's for actual travel contracts. And some facilities, some agencies, sorry, um they do have a variation of mileage for what qualifies as travel and what qualifies as local assignments. Some places are like more than 50, some places like more than 60 or more than 70. But if it's more than 50, you can definitely get away with being like local and driving, because I've done that before. Another thing I want to say is, if you're gonna do a local travel assignment, if you are making that 45, they'll probably give you like $50 or so for shits and giggles. Like they'll probably give you $50, but then that entire thing is gonna get taxed. Versus an actual travel assignment where only the $900 or only the $25 an hour is what was getting taxed. Okay, so just little bits and pieces. Another thing to consider is also the licensure. So there are agencies that genuinely do help you to get your licenses. California, for example, if you're doing it by yourself, it took me a year to get mine, and I only got it after the year because my agency got involved, and they apparently are located right across the street from the Board of Nursing, the California Board of Nursing, and they assisted me with getting it. Okay. Other than that, let's say if you're in Maryland and you want to go to DC, for example, they would help you with that process. You wouldn't have to pay anything. There are some agencies that tell you that they'll reimburse you. So all you have to do is like save the receipts, and they'll do everything for you on the back end, like give you back the money. But usually if you need a license for a travel assignment, they'll assist you with that part of it. So yes, like if you sit and check the numbers, travel nursing could be a very good alternative to hospital nursing, because it's still going to be bedside nursing, to be honest, but you just have more perspective, more experience, and then you have another thing that you can put on your resume just in case. Aesthetic nursing. So aesthetic nursing is another topic that I want to talk about, because of course a lot of the girlies are going to it because it is a form of soft girl, soft nurse, soft everything. Okay, not to say that there aren't any risk associated with the specialty, because there are, but it's just the fact that you're not at the bedside. You just get one patient at a time, like you get that one-on-one, which honestly is what I thought nursing was going to be. But then you're in the hospital and you're literally splitting your attention with everybody, which I understand that point, but it can get a little bit frustrating and overwhelming, especially when you work at a facility that doesn't necessarily appreciate the idea of appropriate ratios. Then we get a little, the topic gets a bit touchy. So if you can get into aesthetic nursing to get away from bedside, I would say this is a very, very, very good option, very good thing to do. It will require a upfront investment, because most of the time you have to do like a certification, or if you're going to work with an office, then they'll tell you, okay, you just have to pay for like the class, and then you can maybe do like an internship or something with them. But overall, I really do feel like it's a very, very, very good investment. There are states that say that you don't necessarily need a medical director to open your own med spa, your own practice, to do injectables and lasers and all that good stuff. But there are also states that do require you to do that. So let's say me, for example, I know I have interest in it. I want to do it. I have people around me that are nurse practitioners that I could ask, but the topic gets a bit sticky sometimes. And me personally, if I ask you one time to do something for me, not even as a favor, because there would be payment involved, but if I ask you one time to do something for me and it's like It's like, okay, I'm gonna do it myself. That's why I'm in nurse practitioner school right now. Because if I gotta kiss your ass to do something, I'm gonna just do it myself. It's a no for me. It's a no. So yes, it can be very, very, very rewarding. Um, for one syringe of Botox, or it's probably running like $800 if you price it well. For one syringe of like filler, it'd probably be a good $1,500. So, babes, and each appointment is probably like a good, I want to say max of 30 minutes. So if you only open your practice from like, let's say, if you open your practice from like 9 o'clock to like 5, so that's 8 hours, right? With your break. So let's say 7 hours, and that's 30 minutes a client. That's on a low end too. Well, maybe not, depending on what they're getting done. But let's say for shits and giggles, let's say 30 minutes. So 30 minutes, actually no, that's 8 hours. So that's 14 patients for the day. So 14 times, let's say you're doing Botox. That's $11,200 for the day. Or if you do 14 patients times a full face of filler, that is $21,000 for the day, babes. Even if you're doing laser, even if you go in and you start doing laser at first, and then you transition on to doing some Botox and fillers because you're working on your courses. And I'm talking to you, but I'm talking to me at the same time because I've never actually like sat and did the numbers, but I just did the numbers. So don't be surprised if you start seeing some aesthetic nurse content up here, because I could use this right now. I would not be in America right now. I would be in London. I would be back in Jamaica, or I would be in Jersey with my parents for a little bit. You're telling me you don't need 21 grand in a day, in 8 hours, babes? They're out there, okay? Get it? They're out there. The last thing we're gonna talk about is just the overall idea of bedside nursing versus soft nursing. Now, I will honestly say that when I went to Howard University, HU, you know, when I went to Howard University, aesthetic nursing was not talked about. Informatics was talked about briefly, just like a little extension of it. Nurse navigator was not talked about, like just the extra stuff that's outside of bedside nursing that we could possibly go into to give us a little bit more peace of mind. Like, it's more emphasis on us having to go and start at a hospital and all of that versus, you know, branching off to all these other things. I think more so because, yeah, they know that they're short. But on the flip side, I feel like it's also doing us a disjustice because we could have been happier. Like, we could have already found something to give us more peace of mind. Okay. I was listening to a podcast this morning. It's called Mindset Mentor by Rob Dial. It's on Apple Podcasts. I'm pretty sure he's other places as well, but I listened to him on Apple Podcast. And the saying was, give me a second, let me see if I can remember it. Happiness is peace in motion, and peace is happiness static. So basically not moving. And when he said that, I was like, you're right. Because I can honestly attest to the fact that even though I'm at bedside still right now, and I'm in travel nursing, I'm making some more money, I'm not 100% happy because I feel like I'm constantly moving, I'm constantly doing all these things, and I'm in school and I'm still doing lashes. Like, I'm trying to grow a business and I feel so guilty that I can't grow the business because I know I have all these other things that's going on. So, like, happiness versus peace, that's I'm at that gray area right now. That's exactly where I'm at. Like, I feel like I'm happy, but I don't have peace. And that's why I took it up on myself to start making videos like this, because I do really feel like a lot of these places are doing y'all a disservice by not really letting you know like what's really out there, what's to expect. Like, yeah, you know, you talk to your preceptors and they're like, yeah, this is it, like you go to clinicals and all of that, but babes, it is so much deeper than that. Oh my goodness, it is so much deeper than that. Like, There are days after work when I genuinely just want to cry. And I have cried after work before. Don't get it twisted. I have cried after work before. Okay? So, all in all, I just want to say good luck. I hope that you guys consider all the points that I have presented in this video. Okay? Please share it with someone if you know that they're probably in nursing school or they need a little help with trying to decide what route they want to take, if they want to go the traditional bedside route or if they want to do something else. Because I know he or she could use the help. They definitely could. Okay? I hope that you guys have a wonderful day. Happy New Year. If you're seeing this after January 1st, it is currently December, Jesus, I don't know my days anymore. I think it's the 20th or 21st. Oh, Saturday, December 21st at 11:58 p.m. So, Merry Christmas when Christmas comes. And Happy New Year. And I hope that you guys have a blessed and wonderful day and a very successful new year, and do your vision boards because y'all got this. And don't let these people play in your face. Okay? Bye.